Now, this was the tail end of the lecture on non-narcotic centrally acting analgesics, such as clonidine and tramadol, and I would have continued it on my previous lecture, but when I make them too long, they don't upload easily. They take forever. So this still belongs with tramadol and clonidine, but the drug interactions are very similar to other central nervous system depressants. So you don't want to take tramadol or clonidine with alcohol or anything else that's going to suppress the central nervous system. Of course, nursing implications, you're always assessing for pain. Watch for whatever meds the patient is on, although there are going to be fewer chemical interactions with drugs such as this rather than there would be with opioids. Patients should always take absolutely as directed. Don't crush it and snort it like you see patients taking it. They should take it PO in the dosages ordered. As they have improvement, they should decrease the dosage. Warn people about lightheadedness and syncope because of possible blood pressure changes. And of course, as with all of these meds, keep out of the reach of children or pets, and don't operate heavy machinery until you know how these drugs are going to affect you. All right, we are going to briefly talk about other forms of pain relief. When we started, we were talking about drugs for moderate to severe pain. Now we're going to be talking about medications for mild to moderate pain. We've already talked about some of these, so we'll talk about them strictly as relates to pain. But acetaminophen is an easily recognized drug. People take it all the time, so otherwise known as Tylenol. It's sort of in a class by itself because acetaminophen, even though it will treat fever and mild pain, it doesn't have any inflammatory effects. It doesn't work on the tissue, it works in the brain. So whereas anti-inflammatories actually cause physical changes that will improve pain, this works on the brain so you don't perceive it as much. So acetaminophen is very helpful. It's an antipyretic, so you can take it for fever. It works on the hypothalamus heat regulating center. It blocks what are known as pyogenic cytokines. Those are chemicals produced during the inflammatory process that will make the temperature go up, so it helps reduce those. It creates vasodilation, so a person's going to sweat, and that will cool them off. And it just generally acts on your perception of pain in your brain. You feel like you're feeling better. So this is used for chronic non-malignant pain. Now, when we say non-malignant, we're not talking about cancer. We are talking about pain that is dangerous. A malignant pain can indicate pain that is life-threatening, like the pain of a heart attack or the severe headache found with a very high seizure pre-stroke. Those are considered malignant pains. A non-malignant pain is a pain that, yes, it's annoying, yes, it's frustrating, yes, it's uncomfortable, but it's not going to kill you. So a tension headache, a strained muscle. These are pain in which you know the cause, but it's not going to kill you. You're taking this for comfort. Now, the adverse effects to Tylenol are very few. It can be considered to be very safe to take, but somebody can have rare blood responses. It'll change your blood or blood counts, blood dyscrasias. It's most known in its adverse effects for liver toxicity. Overdosage can be fatal fairly quickly. Now, when we're talking about overdosage, there's acute overdose in which a person just takes a whole bottle of Tylenol because they want to end it all. Or there's chronic overdose where every single day the person is regularly taking Tylenol, and over a long period of time it's going to affect the liver, especially if taken along with alcohol or other medications that are hard on the liver. For an acute overdose of Tylenol, it's approached in a couple different ways. If the person has been found to have taken a huge amount of Tylenol, within about an hour, somebody takes a whole bunch of Tylenol and then right away they change their mind, they're sorry they did it, and they call 911. If you get them in there within about an hour of acute ingestion, you can give the patient activated charcoal, which will absorb a lot of the poison. And they can have gastric lavage, where there's fluid introduced into the stomach and then sucked back out again, what they call stomach pumping. If 8 hours of acute overdose have gone by, you can give a drug called Mucomyst. Mucomyst is a weird little drug. When it's given as an inhaled medication, it's an asthma treatment. It will help open up a person's airway. But if it's given in liquid form, it enters the bloodstream, it binds to the Tylenol that still remains in the bloodstream, and it can carry it off before it has a chance to do severe damage to the patient's liver or other parts of the body. So within 1 hour, where it's still in the GI tract, activated charcoal and pumping the stomach, within 8 hours, you can usually administer Mucomyst. The generic name for Mucomyst is acetylcysteine. So you've got acetylcysteine for acetaminophen. That's a good way to remember it. Most dangers of drug interactions are with other medications that cause hepatotoxicity. So somebody who regularly takes Tylenol for aches and pains, but washes it down with, a 6-pack of beer every night or Jack Daniels or whatever, they're going to run into problems eventually. Let's talk about steroids. We've already talked about steroids in a couple different ways, but now we're going to talk about them again. Remember that inflammation can cause pain. And so steroids work to decrease inflammation. So rather than acting in the central nervous system, they act at the actual site of the tissue pain. There are a lot of ways steroids can be given. They can be given IV. We talked about that. Solumedrol, often given when a person has an acute exacerbation of COPD or something where they need a lot of steroids quickly. Steroids can be given topically for skin problems. They can be taken PO, like you see with a steroid dose pack. They can be given as an epidural to decrease pain in the spinal area. Lots and lots of side and adverse effects to steroids. And if you'll remember, I passed out sheets that talked about the steroid side effects along with chapter 16. We will also discuss steroids a little bit further in chapter 12, because with musculoskeletal impairments, sometimes people end up taking steroids for those. All right, let's talk about NSAIDs. We already have talked about Motrin quite a bit, but NSAID stands for non-steroidal anti-inflammatory drugs, and these are discussed on page 221. And looking down at the bottom, we'll be talking about skeletal muscle relaxants in a minute. So we know that our prototype drug for NSAIDs is ibuprofen or Motrin. Nobody is really sure how the NSAIDs work completely, but they're thought to block prostaglandins. Prostaglandins will give you a lot of the inflammatory response. For instance, prostaglandins are responsible for menstrual cramping. And so if these prostaglandins are blocked, there's going to be an analgesic, anti-inflammatory, and an antipyretic effect. So Motrin can help with pain, inflammation, and fever. Many times aspirin is often included with an NSAID, as we talked about before. NSAIDs also act at the site of tissue. They decrease inflammation, so there's an actual being affected at the source of the pain rather than just affecting your perception of pain like Tylenol does. These NSAIDs can be used for rheumatic disease, degenerative joint disease, osteoarthritis, any acute musculoskeletal problem like a sports injury, a strain or a sprain, some kind of a muscle pull. The most common adverse reactions with NSAIDs are GI reactions. Drug interactions can really vary, so you just want to kind of read the product information and what might interact. But anything that's going to affect the GI tract or the kidneys can interact badly with NSAIDs. For patient teaching and nursing implications, you don't want to give ibuprofen or another NSAID to anybody with liver disease, anybody with stroke symptoms where you're not sure what you're dealing with, or transient ischemic attacks. If you're not sure whether you might be dealing with possible ischemic or hemorrhagic stroke, avoid NSAIDs.